Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's news conference for the latest in COVID-19 information to the community. Let me go ahead and introduce who is briefly introduce who's on our panel. I'm joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Director of Public Health, the City of Amarillo, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lementier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. Our medical professionals will give us brief statements, and then we will turn it over to our media to ask questions for the panel. We will start today with Casey Stoughton. Casey, how are you this morning?
I'm good, Dave. Thank you. You know, we hate to be back here with you, but we're glad to have such a great team. We're glad to have our wonderful City of Amarillo. We are sad to be back in the level orange. We're sad to be back, to have the need to be back on these press conferences, but we are glad to have the resources to do it and to be able to speak with you today. Our format will look a little different. So we're going to have statements from our hospitals and our medical professionals, and then be happy to answer any questions. We want to be brief and to give you the most up-to-date information. So we'll kick off with the numbers, and then we'll turn it over to our hospitals. As of yesterday, there were a total of 35,695 total cases of COVID-19 in Potter and Randall counties. That was an increase of 155 cases. So certainly our cases are increasing, and we want to be aware of that. We have 852 active cases, and we're up to 744 deaths here in our community. Since July 22nd, we've had an increase in 298 active cases. Again, our cases are certainly increasing. At today's 2:30 report card, the numbers will be updated with additional case information. So check out AmarilloAlerts.com for the report card. Since we're in level orange, we've reinstituted that report card. And you can see the dashboard and the report card there at AmarilloAlerts.com. Level orange indicates that our community's hospital capacity is limited. We do appreciate our hospital CMOs being here on our call today to talk about their hospital experience. But just a quick update. All of the information that I'll talk about right now is on our dashboard. But what level orange means is that our adult bed utilization is, currently our adult bed utilization is 76.5%, our ICU utilization is at 60%, and our ventilator utilization is at 48%. Our 5-day new case average is at 81 new cases per day. And so all of our metrics are in level orange. So again, our hospital capacity is in that limited level. Yesterday, our GA34's hospitalization percentage was at 5.84%. And that means that just under 6% of all of our hospitalized patients have COVID-19. Testing has ramped up at the drive-through, so call 378-6300 if you need to be screened or tested and directed to the test site. That service is still available, as are vaccinations. Our vaccine clinic is still going strong. We'll be at the Civic Center until August the 6th, so come see us at the Civic Center. On August the 6th, we'll move to the Public Health Department. And so you can see us at the Public Health Department for vaccinations after August the 6th. We do have some information on the variants. The information that we have indicates that the UK variant, the Brazil variant, and the US California variant, along with the Delta variant, are circulating here in our community. While I don't have specific numbers for the variants, the lab has indicated that about 5 weeks ago, the Delta variant constituted about 15% of all of the variants that they reported. 3 weeks ago, that number increased to 52%. And 2 weeks ago, almost 90% of the variants that the lab was reporting. And so that, again, that means that the Delta variant is certainly circulating here in our community. Our public health response doesn't change. Good hand washing, staying home when you're sick, vaccination is key. So please, if you haven't been vaccinated, now is a good time to do so. And social distancing, wearing your mask, all of those things that we've talked about for so long are still so important. Yesterday, the CDC announced a change to their recommendations. They're following the science. And so it's super important to know that change is the name of the game now, or well, it has been since the beginning. Due to that Delta variant, it's now recommended that vaccinated persons in areas of high transmission wear a mask indoors. Potter and Randall counties are both areas of high transmission. And so that's a slight change, but again, due to that Delta variant, it's important to wear your mask indoors for all people, vaccinated and unvaccinated. CDC also recommends school children wear a mask while indoors. We know that currently in Texas, our governmental agencies and school districts cannot mandate these policies. However, it's important that we're aware of the policies and aware of these changes so that we can make wise decisions for ourselves and our families. And that's all I have today, Dave. Just want to pass it on to Dr. Weiss at Northwest.
Thank you, Casey. Dr. Weiss, I'll turn it over to you.
Good morning. So thanks, Dave. So again, I am also very disappointed to be back. I kind of feel like an unwelcome television rerun. But you say, why are we here? We're here mostly because of the Delta variant. There's no doubt about it. Just remind people that Delta variant was originally called the Indian double mutant, and it was first described back in March. Now, we went back and looked at some of our data. We actually had a single gentleman here who did show that variant on March 31st. And then we did not see anything until the third week of June. Then we saw 2 Delta variants appear on our variant list. And since then, well over 70% of the cases at Northwest have been due to the Delta variant. So this really seems to be the major threat. Now, we do know that people can get the Delta variant despite the vaccines, but there still is a protective effect of these vaccines. A good example is we looked at our numbers since April 1st. Since April 1st, we have admitted 111 patients with COVID to the hospital. Out of those, 109 had not received the vaccine. So only 2 vaccinated persons were admitted to the hospital since April 1st. So again, it does show that these vaccines can be effective, at least preventing people from getting sick enough to require hospitalization. So where are we right now? Well, we have 19 COVID positive patients in the hospital. Let me put that in perspective. At the end of January, we had 49. At the end of March, we had 13. At the end of June, we had 2 COVID positive patients in the hospital. Here we are, end of July, back to 19. So since about July 2nd, we have seen a constant increase in the numbers of COVID patients that we are having to take care of at the hospital. So at 19 patients, right now, 18 of those are patients who have not received the vaccine. Only 1 of the 19 has been vaccinated at our hospital. That is 3.8% of our licensed beds. Okay, but that is almost 10% of the total patients we have in the hospital now are patients suffering from COVID. We have 4 in critical care in the ICU, only 1 of which is on a ventilator, thankfully. And then we have 15 on the routine floors. Interesting, we have actually seen several young ladies in the last couple of weeks who are expecting, who have come in with COVID. So we've had to deal with COVID on our labor and delivery floor. In July, we had 5 people basically deceased from COVID. Out of those 5, 1 was a man who had been vaccinated back in January. But overall, the 4 others were non-vaccinated patients. Right now, we're using 11 of our 40 ventilators. Now, the concern is we did 186 tests yesterday and got a 12% positivity rate. Okay? We have been somewhere between 12 and 20% positivity rates essentially for the last 10 days. Now, at the end of June, we had a 0% positivity rate. So again, an indicator of what we're seeing in terms of the rapid rise of these variants. Right now, we have 10 quarantine staffed. We were down to 0 at the end of June of staff being quarantined. So numbers are all going in the wrong direction, unfortunately. What are we doing about it? We're hunkering down again. So we've gone to 1 visitor allowed. Okay? We've closed all our entrances except the main entrance and the entrance by the emergency room. We've taken all the furniture out of the main waiting room, and we have very restricted capacity in the surgery waiting room. So we're going back to the measures we saw 8 months ago when we were in the heat of the battle back at the end of 2020. So lastly, people have asked about the bamlanivimab. That is the antibody that we were giving as an outpatient. We are no longer giving that. That is not effective against the Delta variant. So what we are doing is we're going to Regeneron, which is a combination of some antibodies. But we have a very limited supply of Regeneron right now. But we do continue to give remdesivir and Decadron to those inpatients, and we do not feel there's any concern about the supply of remdesivir. So that's my message from Northwest. Again, I'm very concerned that we're seeing trends that are not very not very likable here. I do recommend, please consider getting the vaccine. That's our best way of trying to stop this virus, stop these variants. And I myself am starting to wear masks again in public, in places, because we do know that people with the vaccines can still contract the virus. Thank you very much.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
Good morning, David. Thank you. I'm doing well, and I appreciate the ability to be back on this call with these leaders today. Unfortunately, it's because we're surging again in terms of our COVID cases in the community. BSA today, and I just got done with a meeting with our leadership a little while ago this morning. We are in a significantly worse state than we were several weeks ago in terms of COVID volume. We have 53 patients in the hospital this morning with COVID-19. Dr. Weiss just told you they have 18 to 19 patients. We have 53. And that is a significant portion of our inpatient population. Today, our total census was 283. So it's almost 20% of our total inpatient census. The overwhelming majority of these patients are unvaccinated. We are admitting some patients that have been vaccinated. But when you look at those individuals in terms of the cohort, many of them have immunosuppressing conditions or on medications that cause their immune system to be less responsive, either to the vaccine or to even natural infection. So again, there's an explanation why some individuals who've been vaccinated are getting infected. Furthermore, again, we know that it's a suboptimal level of vaccination that we've had across our region. We are the ranked third lowest metro in the state in terms of vaccination rate acceptance, less than 40%. That's disappointing based upon all the evidence that we have out to date regarding the effectiveness of vaccines. The Delta variant, by no question, is the predominant variant we're seeing now. We've been confirming Delta variant cases here at BSA as well. It's across the nation, as Dr. Weiss and others mentioned today. With that being said, there was good data that recently came out in an observational study out of the United Kingdom that showed if you've had 2 doses of the Pfizer vaccine, the vaccine is 88% effective against the Delta variant. That is amazing in terms of the efficacy of that vaccine against a resistant mutant that's been causing severe disease, more transmissible, and a greater lethality with that mutant compared to the original strain that came out. So again, put that in perspective. Unfortunately, out of the 53 patients that we have today, 20 are in the intensive care unit, 26 are on our med-surg ward. We continue to see patients waiting in the ER that are pending admission, 5 of those today in the ED with COVID confirmation that are waiting for beds. And it just as Dr. Weiss mentioned, we have 1 patient in L&D and 1 in our pediatric unit that are confirmed COVID cases that required admission. So this is affecting all walks of life in terms of age ranges. Yes, those that are older more predominantly, but it affects everyone potentially, depending upon their unique genetic makeup and their immunity. We have 14 staff quarantined today because of COVID infection, and some of those staff members have been vaccinated. The vaccine is not 100% effective, but it is very effective at preventing severe disease. For the individuals that work at BSA that have been infected and have been vaccinated months ago, when I've talked to them, their responses have been, I had either very mild symptoms and I obviously had to quarantine, or, no, I was having a pretty good cough and I was short of breath. I didn't require hospitalization, Dr. Lamentier, but thank God I got vaccinated because I can't imagine what it would have been like if I had no immunity before getting infected. It's a scary illness, and that's what people will tell you when they get the infection and they've had those symptoms of not being able to breathe. For individuals that really feel like they're still uncertain about the vaccine, I'm going to tell a very brief story, and then I'm going to pass the wand to Dr. Gonzalez, but I think it's pertinent. And I think a similar mindset has been seen here as communicated by our doctors and the patients they're interacting with. There's a physician in Birmingham, Alabama, who wrote a very short but poignant commentary in an article I read recently. And her name is Dr. Kobia, and I'm quoting this out of an article that she was cited in. And she basically said she works as a hospitalist, and as she's seeing patients on a daily basis on rounds, one of the last things that patients oftentimes say to her before they go on the ventilator is give me the vaccine. And she has to look at those patients and say, it's too late. I can't give you the vaccine. It's not going to be effective now at this point in your illness. And they end up going on the ventilator. And then she says a few days later, when she has to call their time of death and they're pronounced because they had a severe case of COVID and they unfortunately succumbed, the family comes to them crying and saying they thought it was a hoax. They thought it was just the flu. And then Dr. Kobia goes back to her office. She may cry for that patient and she says a prayer in hopes that the prayers are going to be granted to say, maybe this will save future lives from succumbing to COVID if we can just get more people vaccinated and understand the severity of this illness. I think that's a poignant story that really is a microcosm of our whole country in terms of individuals that are understandably at times uncertain about all of the information coming in front of them. We can assure you that these vaccines have been highly effective for those that have received them. And even those that are getting infected that have been vaccinated, the bulk of those patients are doing very well with minimal symptoms. So again, we urge you to get vaccinated. We urge you to be careful. And we at BSA will continue to work to take care of patients that get sick and do our best to manage those cases. But unfortunately, our nursing resources across the region are being taxed. And we do not have the RAC state support at this time to help with additional peaks. It takes time to get those resources mobilized. And if we get a large increase beyond the number of patients we have now, we're going to have difficulty staffing beds to manage those patients. That's all I have, David. Thank you.
Thank you, Dr. Lementier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
Thank you, David. So first of all, from Amarillo, I like the other panelists, like being here and the fact that we get to talk to our community what's going on. However, the reason that we are here is an unfortunate situation as we watch the COVID virus continue to increase across our community. Currently in the Amarillo VA, we have only one hospitalized COVID patient. We did have 4 earlier this week, 3 of which we were able to discharge since then. So we have also watched our numbers increase. When we look at our hospitalized patients, we're seeing the exact same thing that Northwest mentioned, that BSA mentioned, that just recently came out in a national publication where a majority of those, an overwhelming majority, are either not vaccinated or did not receive the full 2-dose sequence of the mRNA vaccine. When you look at our numbers, it's about 90%. Now we have very small numbers, so one changes it a couple percentage points, but very similar to what everyone else is seeing. When we look at our veterans that have been hospitalized in the community, that's the Lubbock community up here and other areas in the Panhandle, since April 1st, we've had 10. All 10 of those were non-vaccinated veterans. So, I would encourage everyone to think about the vaccine, consider getting it, and encourage you to actually get the vaccine as I have done. Right now, when we look at our veteran population, we are tracking about 43% of our veterans are vaccinated. So just to put this, not to get too detailed in statistics, and I am not a statistician, but if 43% are vaccinated and over 90% of our hospitalized patients with COVID are non-vaccinated, that just shows you the protection of preventing severe disease and hospitalization that this vaccine has. And so I would encourage, we continue to have the vaccine available both at the Amarillo campus and the Lubbock campus. We have Moderna and Johnson & Johnson available. So Johnson & Johnson is a single dose, Moderna is the 2-dose series. And so encourage veterans or dependents of veterans or caregivers of veterans, if you want to be vaccinated, and it's easier for you to come to the VA and do it, please come here and we'll get you vaccinated. I do know there's many other resources to get vaccinated also, and just encourage you to get the vaccine. With that, that's all I have, and thank you for the time, David.
Thank you, Dr. Gonzalez. We're now going to turn it over to members of our media who are in attendance. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with Dalton Williams of KVII Channel 7. Dalton, how are you? We'll go ahead and start with Dalton Williams of KVII Channel 7. Dalton, if you have a question, you may go ahead and ask it now. We will come back to Dalton here in a minute. Let's go ahead and go to, if I'm not mistaken, we have Kevin Welch of KFDA News Channel 10. Kevin, how are you? We have Kevin Welch of KFDA News Channel 10. Kevin, how are you? We will come back to Kevin as well. Aaron Langston of KAMR Channel 4. Aaron, can you hear us?
Yeah, I can hear you. Can you hear me?
Yes, I want to go 3 for 3 on not having media access today, but go right ahead. You had a question for the panel? Go right ahead, Aaron.
Alrighty. First off, for the hospitals, are you all looking at, or have you already started to expand your bed capacities with the increase in cases and all being hospitalized?
Well, Aaron, I'll be honest with you, we are in the same situation that Dr. Lamentier alluded to, which is we've got beds, we just don't have staff to man those beds. So that's part of the challenge right now is, we were essentially at capacity in terms of, for common things like traumas and stuff like that. And now we're getting this COVID surge, but our real shortage is nursing staff. And after we lost a lot of nurses that went traveling, a lot of them have not returned to work yet. I know some of them are back in the community, but are not back to work. And so, yeah, right now, that is our base limitation is people and not space or beds.
That's correct. We have not had to expand the number of ICU beds, although I will say that we are in the 94% range of utilization of ICU beds today. Again, the most of those are non-COVID. I said 20 patients are COVID ICU patients. We've had to expand out of our one unit that we start with for COVID and go into a second intensive care unit. And we're also making additional accommodations on our med-surg unit to accommodate that increasing number of non-ICU COVID admissions. So yes, it's starting to impact what we do with patient flow. It's starting to impact what we do with selection of certain patients for intensive care versus a step down intermediate care. And as the number grows, it will continue to do so.
And coming off of that, is the availability of RAC staffing resources or asking the state for staffing resources an option like it was previously?
And I can tell you, we can ask, but I have not heard anything about mobilization of traveling nurses like what happened a year ago.
That's correct. We are working diligently to get contract nurse staffing, which we do when we have deficiencies with nursing. And because of the nursing deficiency, number one, across the state and across the country, that's problematic. We are augmenting our rates to try to hire and be competitive with contract nurses. But at this time, the state has not commented on providing us any additional support. Has
the health department or anybody had any discussions with local schools about preps getting ready for kids to head back to school and knowing about half of a normal school population cannot get vaccinated yet?
Absolutely. We work with our schools, regularly and have lots of good conversations with them. They also receive guidance from TEA and other resources. So there's a lot of good conversations happening.
Alrighty. And do y'all have any recommendations for parents preparing to send their kids back?
With the CDC guidance, the CDC's recommendation is, to wear masks inside if you're vaccinated or unvaccinated. Anybody over the age of 12, certainly vaccination is an option there. So lots of good resources, but with school starting, those are definitely going to be conversations that parents need to think about and to have. So anytime we get groups of people together, then we certainly anticipate spread of COVID. So we'll certainly keep an eye on that.
All righty, and last question. Has there been any discussion or work towards maybe reaching out to the governor's office to see if there is a possibility of them amending the most recent mask order, which would allow places with a lot of new cases coming up to maybe have more power to enforce masks?
Mary, did you have anything on that? We have talked about that, the possibility of doing that, but we want to make sure that we have a full and clear understanding of both the CDC guidance, the Texas Department of Emergency Management, recent conversations that we had yesterday, the work with DSHS and Dr. Hellerstadt, and have a real clear understanding of what we need to do or what we might be recommended to do and what we're allowed to do through GA 36. The executive order GA 36. So we're having those conversations, but there is no clear, we're not intending at this point to contact the governor's office immediately.
All righty, I think that has me covered. Thank you.
Thank you, Aaron. Let's now go to David Gay of the Amarillo Globe News. David, how are you?
Good morning, everybody. Can y'all hear me?
Yes, sir.
Perfect. So I guess just a clarification, Casey, you threw a lot of numbers about the variance percentages. And so just a clarification on my end, what percentage of the cases are in the Delta variant currently, or the most recent percentage that you have regarding Delta variant?
Right. So currently, the lab is reporting that 90% of the variants that they are testing, and so that is for all of Region 1 and kind of 910, so all of West Texas is at 90%. So the Delta variant is 90% of the variants that they are testing. And so, but I think what's important to note is, just like Dr. Lamentier said, the vaccine is very efficient and very effective. So less than 1% of our cases are what we're considering breakthrough cases. So that's really a key piece to note, is that while that Delta variant is very virulent and it's circulating right now, the vaccination is really protective. And so we have an opportunity right now to really increase our vaccination rates so that we can protect ourselves and we can protect each other, especially our kids who can't be vaccinated.
Absolutely. And I think it was Dr. Lamentier, I can't read my own handwriting, but he's talked about 88% of that the Pfizer vaccine is 88% effective against the Delta variant. Are there any numbers that are out regarding the Moderna, since the majority of the vaccines that have been given out in the community is the Moderna vaccine?
I haven't seen that study. Specifically looked at the Pfizer vaccine and the Oxford vaccine. And the point of the study was to really convey that with one dose of the messenger RNA vaccine, the efficacy was only about 30%, but with two doses, it was at 88%. And I think we have to assume that the Moderna vaccine is very similarly effective as the Pfizer vaccine. Both of those vaccines were in the mid 90% range in terms of efficacy. So I think the presumption there would be a safe one that both are in the high 80% range with two doses of vaccine, as opposed to just one of those messenger RNA vaccines. But again, any vaccination is better than no vaccination when it comes to establishing some level of baseline immunity, especially for those individuals who've never been infected. And for those individuals who have been infected, you may have the best immunity if you were infected natively and then went on to get the vaccine. So there's still a benefit from getting the vaccine, especially if you were infected early in the course of the pandemic when you were not infected by one of the mutant strains, and therefore would be potentially susceptible to the Delta variant and others.
Sure, absolutely. My next question is for Dr. Gonzalez. I'm looking at an AP story right now. The Department of Veteran Affairs on Monday talked about requiring their healthcare workers to get COVID-19 vaccines. I guess my question for you is, where is the Amarillo VA on that process? And are you guys fully vaccinated, or are you guys still moving along for your staff there?
Yeah, so we still continue to offer all of our employees to get vaccinated. And so that policy just came out yesterday. And yes, we are going to be moving forward with it, requiring it for all of our healthcare personnel that are required by the vaccine or by that policy and the statement that came out by the Secretary of the VA.
Absolutely. And how many, I guess, folks does that impact? How many folks need to be vaccinated now per that policy?
I do not have an exact number for you off the top of my head.
Sure, absolutely. And I guess the last question that I have is for the panel. I know that we're going towards the end of summer, and a lot of people are, about to take, last minute summer vacations, getting out and about. I guess what is there any guidance from you guys on whether or not those plans should be postponed, or they should be taking more precautions as they're traveling outside of the Amarillo area in this last part of summer?
Dave, the CDC has some really good guidance on travel. But to kind of sum it up, masking is really important, especially if you are in, larger groups or indoors. But the CDC has some really great guidance, so we're happy to pass that along.
Dave, I just say real quick, one thing we know about this Delta variant is they're saying that it may have upwards of 1,000 times the amount of vaccine or the amount of virus in someone's nose compared to the wild type. And that's why it spreads so quickly. It's a heavy viral shedding that we're seeing. So again, I think if anyone's going to be in a traveling situation, airplanes, airports, things like that, I think the same thing we've been talking about, besides the vaccines, which is critical, is the masks, the social distancing, because this virus is mean in terms of its ability to jump from person to person.
Absolutely. That's all I got. Thank you, guys. Have a good rest of your week.
Thank you, David. Let's now go back to Dalton Williams of KVII Channel 7. Dalton, how are you?
Good morning. Can y'all hear me now?
Yes, sir. We can. Go right ahead.
Oh, okay, perfect. Sorry about that. So my first question is to either Mary Nelson or Jared Miller. I know that, Jared, you had talked a little bit earlier about not being able to enforce mandates and doing everything along with the governor's executive order. But what are some ways that we're kind of trying to encourage people to wear masks until we can get kind of some new orders from the governor?
As far as city facilities and then the work we're doing through public health and other avenues, we're recommending, we're consistent with what CDC is recommending. Up until just earlier this week, we had been recommending unvaccinated persons to wear face coverings when they're inside or within 6 feet of other people. Now the guidance is changing to recommend that both vaccinated and unvaccinated persons wear face coverings. So we're changing our signage around city facilities. And I want to be clear, we'd never considered a mandate of any kind. So that's not something we were wanting to consider. We were trying to evaluate the guidance from CDC, DSHS, Dr. Hellerstadt, and others to make sure that what we were doing and what we're experiencing here is as reflective of those recommendations as possible. That's all we were saying earlier when we were trying to decide, should we reach out to the governor or not? But as far as what we're trying to do to make sure that we're being responsive to the guidance we're getting now, we do have significant limitations on what we can do, even with our own team. The order not only prohibits requiring face coverings to anybody in the community, but it also prohibits us from requiring face coverings for our staff, which is not something that most businesses, they can require that if they want. So we just want to make sure that we're being as safe as we can possibly be within within the boundaries of the executive order. And there is no desire to deviate from that.
Okay. And then my next question is for any of the healthcare workers. Now that we're kind of having cases go back up, how are kind of y'all and your staff at the hospital, how are y'all kind of dealing with COVID fatigue?
I'll start there. I guess what I would say is that our staff is tired. Our staff is concerned that we're on the uptick of another potential surge. And again, it's a situation where mentally and physically, as we all know, when we were in the heat of the pandemic last November, was at the point at which we were at it was at its worst at BSA and in our region. Folks were very worn out. And again, attempting to do their job, and that's what they were trained to do. That's what they want to do. More folks are putting in additional hours. This is not about not wanting to do what they've been trained to do and they're paid to do, and what their overall motivation has been from their professional careers. It's about being concerned that we're not having everyone do what they can in the community to help us avoid another resurgence. And again, we're in a different spot than we were a year ago. A year ago in the summer, we didn't have vaccine. We didn't have monoclonal antibodies. We've got these things now. And the vaccine is your first best defense. So by not moving forward with getting vaccinated, if you're an eligible person to get one, that's imposing on the rest of our community in terms of the risk for you being a burden on the community in terms of getting ill and requiring hospitalization. And that's just the reality of it. It's not meant to be harsh. It's not meant to be in any way condescending, but it's the fact of the matter. We're urging you to take advantage of the resources that you have available so that we can keep people healthy. We want our community to be fruitful. We want our folks to thrive. Amarillo is a great city. Let's do what we can to protect one another.
Yeah, Dalton, thank you for the question. I'll be honest with you, I'm very worried about a lot of our staff. I mean, we are finding or hearing stories about nurses that being found in tears saying, I can't do this again. I can tell you, I know several people at the hospital that have decided upon retirement probably before they originally planned because they're tired. So the fatigue is very real. And then on top of that, as Dr. Lamontier and I are talking is, now we're in a situation where because of the nursing shortages, we're making some tough decisions already in terms of resource allocation for patients that come in. Both hospitals I know typically have patients waiting in the emergency room in the morning for beds. We've talked to Lubbock, all over this region right now. We're seeing hospitals congested because of not only the numbers they had originally, but now these increased COVID numbers. This is tough. I mean, it's tough for healthcare workers to make these decisions and to see people in need of resources, and we cannot immediately provide it to them. So yeah, I'm very concerned about where we're headed right now and just the overall emotional and psychological trauma it causes to people that are trying to care for the patients that come to our hospital.
Okay, well, thank you so much. That is all the questions that I have today, and I hope you'll have a great rest of the week. Thank you so much.
Thank you, Dalton. One more time, let's go to Kevin Welch of KFDA News Channel 10. Kevin, how are you?
I'm good. Let's try this again. Sorry about that.
Yeah, you're on. Go right ahead.
Okay, Casey, with the uptick in active cases, are you seeing any increased demand for vaccine?
We have. We're seeing about a percentage point a week of our total community. So we haven't quite hit the 40% mark, but we are seeing, we're seeing us get closer, and we have seen a little bit of an increase in demand at the Civic Center. So that's good.
Okay. And do y'all have any new strategies to get past this kind of what seems like a wall in getting to past that 40%?
Yeah, so we're doing our outreach team is doing lots of good work. They're going to daycares, they're going to schools, they're going to businesses. We're going to lots of different events. We appreciated we got to go to high noon on the square. So we're just trying to be available and be convenient for people to be vaccinated. So we certainly appreciate if somebody wants a clinic, then certainly reach out to us. Either at covid@amarillo.gov or at 378-6300, and we can connect you to that outreach team.
Okay, thanks. Doctors, just looking at the recent report cards, it seems like we just now got the first reported death on there. Are there less deaths right now than when we were back in the past?
It's a good question. As a percentage of the hospitalized COVID patients, I think we're probably about the same. Thankfully, we just haven't had a whole lot of COVID activity up until this month. So the deaths have obviously been decreased. But I think in terms of just the percentage of patients in the hospital who are critically ill now with COVID and possibly, at the end of their life, it's probably about the same as we were seeing previously.
Okay.
I would agree. Of the patients that are not vaccinated, the mortality rate looks to be identical compared to where we were before. For the patients that are vaccinated, it's a different story, but we have such a small number of those patients that are being admitted. It's hard to know where that statistical significance lies.
Gotcha. And can y'all recap the vaccination percentage rates for your staffs in the hospitals?
I can start. We're rated about 60% of all employees. That includes everyone, not just our front line healthcare workers. About 60% of our employees are vaccinated.
Yeah, I would say at Northwest, we've been hovering more around the 50%, a low 50 percentile for all our employees.
And the Amarillo VA, once again, this is all employees and not just frontline healthcare workers. We were sitting, I think when I looked this morning, about 62%.
Do you all find a difference between medical staff versus all the other staff as far as vaccination rates?
It's a good question. I specifically wanted our team to pull those numbers. Our numbers are higher for medical staff members, closer to 69% of medical staff members. However, we were only able to obtain those that we provided vaccination for, and we know for a fact that many folks got vaccinated elsewhere. So we're going through a process now where we're doing some additional surveying as part of our vaccination promotion and campaign to get a better number on medical staff. I suspect it's higher than that 69% when we factor in those individuals who were vaccinated elsewhere.
Yeah, and we're doing the same thing. We are building an incentive program, and there too for any staff that have gotten vaccinated anywhere. So we know the numbers of who we vaccinated, but now we're starting to see people bring in verifications of vaccines from other sources like the city or some of the pharmacies. But I'll still say there are medical staff or hospital staff members who are directly in contact with COVID patients. They're still struggling with the decision to get a vaccine. And it's unfortunate because that does put them at risk.
Okay, thank you, everybody. That's it.
Thank you, Kevin. That concludes our news conference for today. I want to thank all of our panel members who took the time out to provide this valuable information to the Amarillo community. Thank you very much. And this concludes our news conference for today. This is David Henry, Communications Manager